Oet Speaking Masterclass. This is usually like the first test for the exam. Like if you're taking the test, so usually the first one. And we know what speaking is all about. It's just you and somebody interviewing you. So like every one of us, we are engaged in conversation with people every day. We engage in conversation with patients. We engage in conversation with doctors if you're working in the health sector. So just imagine that you're speaking with a colleague, either a nurse, a doctor, a patient, or you're speaking to a doctor. So overview of the Oet speaking test is a face-to-face examination between an interlocutor and you. So the interlocutor is somebody that is interviewing you, also standing as your examiner, may not be your assessor, because the exams is always assessed by another, like board of, like some panel and all that. But this person will be the one to record, to say this is what you did. So that's an interlocutor. He's also serving as your client or your patient, the person you are interviewing, or the carer, whoever, or family that you are talking to. So that's the role of the interlocutor. The interlocutor would always have a card. They will have their own card of what they are supposed to ask you. You don't have access to the role card or role play card of the interlocutor. So the speaking test will be specific to your healthcare profession. This is very interesting. So if you're a nurse, your speaking test is different. If you're a doctor, your speaking test is different. But they almost all are. They have the same pattern and the same preparatory mode. Only that the questions, the healthcare related topic might be different. All right. So, but in this program, in the Oet study program, we will cover topics that in medical and nursing topics. So if you're a doctor, this will also be beneficial to you. So this is not just open to nurses alone, like I've mentioned. So you'll be able to complete 2 role plays. So for the speaking test, you have to complete 2 role plays where you will take the role of the healthcare professional. So if you are the nurse, you are taking the role of a nurse. If you're a doctor, you're taking the role of a doctor. And you're given a role play card of what you should do. So interlocutor would take the role of the patient, the carer, or family member of the patient. Depending. All right, so the Oet speaking is approximately 20 minutes. So like I said, you have 2 role plays. Before the role play, you have some warm-up questions that will be asked by the interlocutor. Remember I said that your interlocutor is also like your examiner. So your interlocutor is going to ask you a few questions, maybe about yourself, about just some things around what you're doing. So some example could be, tell me about yourself. They just want to see how you're able to, express yourself. This warm-up questions is not assessed. It's not part of the assessment. So you will not be scored for that. It's just a way to get you to settle down, and to also have that rapport between you and your interlocutor. So there are 2 role plays. You have 5 minutes each for each role play. So in total, you have 10. So the things you need to find out and know about Oet speaking, we will go in depth in the main program. You need to know who is your patient, what do you need to find out from your patient, what do you need to tell your patient. So these are the 3 key things that you need to be able to focus on, and of course expand for the Oet speaking. Of course, communication in English is very important because that's what they want to see. I know a lot of us, some people are very nervous about this, especially if you are not from an English-speaking country, or English is not your primary language of communication, or official language. Just like I said, like English wasn't. But over time, we just have to learn. So when speaking, particular, you need to cover the following 4 linguistics. So these are the things that the assessors will be looking for. They want to see your intelligibility, they want to see your fluency, they want to see the appropriateness of language that you're using. They also want to see your use of resources of grammar and expression. All right. So again, in the study program, we are going to break this into pieces. We are going to break into pieces and give you tips on how you can achieve each of these criteria. Now, this is a sample of a role play card. I need you to just take a look. I'm going to pause there for 30 seconds. Just take a look at the role play card, read it, digest it, look through it. Do you think this is something that you'll be able to answer? You don't have to respond to me. Just take your time and go through it for 30 seconds. All right, so you look at this. So your role play card is like this. This, like I said, this is different from the role play card of the patient or your interlocutor. So you find the setting, the community health setting, you are the nurse, and this is what happens, and you have your task. So this is what they said you should explain the rules and regulation of community health center, assure him to find someone who can do this and the rest. See, so the most important thing in this is you don't have to have an understanding of the concept. It's not compulsory, although it's going to be an added advantage for you. But they really want to see how you are able to communicate this. Again, when we start if you join us in the Oet Study program, we're going to break this down, how best you can, answer this correctly.